Well, the state topped 4,000 new positive cases of COVID-19 today, the most in a single day since January 15th. Hospitalizations are also on the rise, and that has those in the healthcare system concerned. Pat Bean reports.
Indiana is ramping up COVID-19 testing sites once again. This after closing them in June, as new daily cases of the virus climbed above 3,500 this week. Hospitalizations, as you'd expect, are also up, more than 4 times as many as July's low of 371. It's one more wave for a weary healthcare system that has been battling COVID for over a year and a half.
Nurses are tired, respiratory therapists, physicians, everyone, our environmental service workers, they've all been working so hard for so long dealing with the pandemic, and that takes a toll.
Tabor is the president of the Indiana Hospital Association. He says he is worried about the availability of ICU beds, especially those for pediatric patients not eligible for the vaccine.
Pediatric intensive care beds are scarce. There aren't a lot of them. And so if we were to see these trends increase, we don't know yet the full impacts of back to school. That is something that we're going to have to monitor very closely.
David Porter is a family medicine doctor in Columbus, and he says he's seeing a lot more sick children from the virus.
I really feel for the parents of kids under 12. Those over 12, they should be encouraging their children to vaccinate. And unfortunately, children don't have that choice to vaccinate themselves.
And until the FDA approves the vaccine for those under 12, wearing a mask is just about the only protection. The vaccine is readily available for everyone over 12, but Porter says the problem is convincing enough people to get it. Barely half of those eligible to get the vaccine in the state have gotten it, although the numbers of first-time shots is on the rise. Still, Indiana ranks around the bottom third in the nation for percentage of population vaccinated. Porter says he continues to see patients hesitant to get the vaccine.
We hear the gamut, various people have concerns about how quickly the vaccine was created, that it's still under emergency status, all the way to, hey, I hear that it's going to turn us all into zombies after a year or two.
Tabor says the numbers don't lie when it comes to the effectiveness of the vaccine, despite breakthrough cases.
98% of the hospitalizations that we're seeing are with unvaccinated patients. So we know that the vaccine is effective and can reduce that strain on the system.
For Indiana News Desk, I'm Pat Bean.